we'll be looking into the topic of anatomical terminologies under the textbook of general anatomy. We have 4 textbooks, that is the general anatomy, head and neck, upper limb thorax, abdomen and lower limb. So in this chapter we'll be learning about the different positions. It is a very short topic. Anatomical position, the body is erect. So we need to define what anatomical position is. Here the body must be erect, eyes should be pointing straight, then upper limbs must be hang by sides of the body with the palms facing forwards and fingers should point downwards. You can imagine the position, it is exactly like how you stand, and the only thing that you need to do is you shouldn't bend any of the joint. The body must be kept erect and the palms must be facing forwards, and the lower limbs including the feet must be parallel to one another, and the sole part of the foot must be kept down onto the ground, pointing, the toes must point forwards. We'll just see how anatomical position is. So this is the anatomical position. You can see the palms facing forwards. We'll see fundamental position next. Fundamental position is exactly similar to anatomical position. The only difference we find here is about the palms, that is the palms are not facing forwards, instead the palms must be kept sideways to the body, that is the palms must face towards your body. So the body is kept erect, eyes must be, as we all know that eyes must is exactly like the anatomical position. Here the only difference is seen here, so you can easily make out where your palms are facing forwards in the anatomical position and sideways to the in the fundamental position. And this is the supine position. This is exactly how you sleep, but the face must be facing upwards and the whole of your body must touch to the ground. The person is lying on the back which faces with face directing upwards. This is the prone position, which is exactly opposite to the supine position, where the person is lying on his belly, that is opposite to the supine position, facing his face downwards. This is the lithotomy position. This position is usually done under rectogenic or urogenic surgeries, or in the gyno-OB or in the OB-GYN surgeries, like in cases of usually in the parturition time. This is the position where a lady or a person is asked to keep the foot, the shin part of the foot on the boot like leg holder. So if the person lies supine with the buttocks at the edge of the table and hips and knees are semi-flexed. Flexed is just nothing but, time being you just understand it is a bend. So semi-flexed and thighs are abducted. Abducted is to take something away. Abduction, like how you have abduction, is just separating the feet, the lower limbs. So this is the lithotomy position. Thank you. That's it for today.